that 13 men concocted a health care bill behind closed doors. The fact that this legislation is being rushed and secretively written screams at me. And I really would like healthcare legislation to be addressed thoughtfully and publicly. The timeline of this proposed bill is not scheduled to take full effect for years, and that spares current politicians the consequences at the polls for the harsh cuts in Medicaid funding. And that also screams at me. That says that the people pushing this know that voters really aren't going to be pleased when the full impact hits. So I am asking you not to support this bill. I have some reasons. The first is that the bill contains a tax cut for the wealthiest members of our nation, and this is wrong. Our nation is becoming more destabilized because the middle class is shrinking, and the gap between haves and have-nots is greater than ever before. And I think, frankly, both the Trump and the Bernie supporters mobilized around this. So another tax cut for the rich only exacerbates the situation, and I think it's harmful to the stability of our democracy. No one chooses to be sick, and if you are sick, you are poor. That's just the math. And I think we as a nation have abundant resources, and we should strive to help people who are sick. And I really think to do otherwise is immoral. If we truly believe we are one nation under God, then our mission should be to help and alleviate suffering of those who are sick. I'm just so moved. Thank you. You represent people of Maine and not the Republicans. We are an elderly sick bunch.
Present company excluded.
Well, yes, and I think Maine will be more impacted, I think, than other states by the way this bill is being written. The fact that our governor has refused to participate in federal aid for Medicaid will further penalize Mainers, because this bill would permanently close access to people who need help. Many elderly people use Medicaid to supplement their Medicare, so this bill would hurt me. On a personal note, my daughter benefited from the Affordable Care Act, and your office was very helpful. She worked abroad after college, and I think it was Evan in your office. He was a wonderful young man. He helped her with the red tape of the. But she came home sick, so sick that she was
From
dead.
abroad.
From abroad. She's brilliant. She's fluent in Japanese, Korean, but for months she was bedridden. And she was able to get help through the Affordable Care Act. And now she's a productive, working, tax-paying member of society. And we would not have been in the, I'm on Medicare. I had no insurance plan for her to come on, and she was over 20 when she was 26 when she came home. So I feel we need to continue to make the care that was available to her still available to all who need it. This is something that's kind of separate, but it's about healthcare in general. And I want to just comment on the attempts to keep healthcare costs down and talk about what I consider the elephant in the room that I don't hear anyone talking about. And I bring my experience of working as a provider in the healthcare system for 40 years. I worked at Mass General Hospital, started in the 1970s. And in that time, our healthcare system was nonprofit. It is now a for-profit system. And legislation was passed under Nixon that started that tide to change. It is not ethical, it is not moral to profit from another's misfortune. And if you don't remember anything I say, I want those words to stay with you. It is not ethical, it is not moral to profit from another's misfortune. And in medicine, and I know because I was a provider just until I retired, The dollar has replaced the heart in medicine, and this stresses providers and patients. Profit motive is the #1 problem in healthcare. And the government passed the legislation that started this, so I'm looking to the government to fix this. That's a tall order, I know that, but until this is addressed, costs will continue to spiral, because there's no limit on the amount of money some people are willing to make on the illness and misfortune of some.
Thank you.
Thank
Very
you.
eloquent.
Well, and you took
And
notes,
thank
but
you.
I left
I
the part
did.
out about
And-
Planned Parenthood. I think other
Thank
people are
you.
gonna, I said more than, thank you for
Thank
listening.
you. Thank you. Haiti, was it?
Yeah, I don't have any.
Okay.
So these are my girls.
I was just gonna say, are you mom?
Yeah, I'm the mom. They're bigger than me, but I'm the mom. And I want to let you know that when we were waiting for Haiti to come home from Guatemala, we were going through the adoption process. She's 11. I was fully employed, and then the job that I had went away. So when she came home, it was very beneficial for both the girls to be able to be covered under Maine care, which they did stay on for a couple of years until we were able to get going again and reinvent ourselves. And then my husband and I, we were successful business owners, and thank goodness the Affordable Care came along, Affordable Care Act, because then we could all have insurance that we could pay for. We sold our business last fall, thinking that we would reinvent ourselves again, and we made that decision largely because we thought we could take our health care with us, and we use it. We use the mental health piece of it quite a bit. So we are concerned, for us, that's going to change, and that's not the direction our family needs to head in. And we have a lot to try to protect, and I know we're not the only family that's going to be affected in that way. So I'd like you to not support something that was decided without taking all of our collective concerns into consideration.
Thank you.
Thank you.
My name's Leafy, and I don't think that this bill is a good idea because I don't think that anybody should have to live with the fear of getting sick or not to make their decisions based on whether or not it will hurt them, and because then they wouldn't be able to live up to their full potential. I don't think that's okay.
Thank you. That was very well said.
My name's George. I'm from Union. One quick little story, and then I'll talk about it. One quick little story was recently I was at somebody's house and we were honoring a young man who just graduated from Camden High School this year, and he graduated with honors. But it was hard for me to hear him say that his mother is taking medicine for some kind of awful condition that really there's not much hope for it, and he thought with the changes in the medical stuff, his mother is going to lose to be able to buy the medicine that she's taken, and that was kind of disheartening to hear this young man having to live with that at his age. Also, it was really nice being here last week or a couple weeks ago, whenever it was, and Patty said that on the news it said, well, the Republicans are coming up with this bill, but they're not telling anybody what it is. It's all hidden away. And Patty said, there is no bill. It's just a suggestion of a bill. And yet on the news yesterday, they're still talking about that just a suggestion. But Patty mentioned that you were working with other senators in a bipartisan sort of way to come up with a different kind of bill. So it would be really I'd be interested to sort of hear what you have to say about that, or when will the news media start talking about this other bill that's going to show up? That would be interesting. The last thing I would like to ask you is if you would be willing to participate in a town meeting here in Maine this fall. And that's just a question I'd be very interested if you could come before the public that way. So thank you.
George, I'm going to ask that you hold this. All you have to do is hold it to record me.
You.
When I speak.
Yep.
Hi, Senator. My name is Tracy Helbuena. I'm an emergency physician here in the state. I'm on staff at Penn Bay Hospital. I'm also a co-founder and leader and organizer of Mid-Coast Maine Indivisible, which includes communities from about Belfast area down to maybe Waldoboro, maybe Damascotta area, the coastal communities there. So primarily Camden, Rockport, and Rockland. So I have a couple of points to make. The first is really informed by my experience as an emergency medicine provider, where we see people who are down on their luck and who have been lacking in resources, sometimes their entire lives, and I mean resources of all kinds, and these factors snowball into an intersection of poor health. So I've learned a couple of things from that experience. One is that it is absolutely not accurate to say, quote, anybody can get health care, they just have to go to the ER. That does not make any sense. I can tell you, as the provider of that ER medicine, that is not okay. That is not good health care. So absolutely do not let anybody get away with saying that, because that is not okay. Emergency medicine is its own specialty. The way pediatrics is a specialty or cardiology is a specialty, asking an emergency medicine physician to take care of your chronic problems or your maintenance health is like asking your orthopedic surgeon to do your brain surgery or deliver your baby. You don't want it. It's not good health care. That was point number one. Point number two is that my experience on the ground, day-to-day basis, interacting with patients, is that if we enact policies in this country that have the effect of reducing resources for healthcare, it will harm people. It will harm people. People will die as a result. I'm talking about the patients there. It will also have the effect of further stressing our current providers, and that's everybody from housekeeping to the CMO and CEO of a hospital and everybody in between. And doctors, I don't know if you are aware of this, are fleeing clinical medicine in droves because of these pressures. Reducing resources for healthcare is going to exacerbate that hugely, which in turn is going to harm more patients. So it's going to have a ripple. Reducing resources for healthcare will have this sort of ripple effect in which patients will be hurt in a couple of different layers, in a couple of different ways. So, taking all that in mind, my question for you is, Senator, will you oppose any health care bill before the Senate that fails to get thorough and meaningful public hearing? Thank you. Thanks.
Hi.
I'm Karen Bellicamp, and I'm going to read. Thank you for giving us the opportunity to come here today. I'm really excited that you're here in person, and wasn't expecting that, so it's good to see you. My story might not be particularly gripping, but I think it's one that is typical in this state, and that is what makes it so important to tell. We're just regular middle-class people who will be severely affected if the ACA is repealed and replaced with this new bill. I'm 56 years old, and my husband Sam is 61, so we're those older people that I know you're concerned about. Fortunately, we're both healthy and physically active, and we enjoy hiking and biking in the mid-coast, and we work very hard to stay healthy. But just as we reach the age where health problems become more likely, it seems we're being penalized and pushed out of the market altogether. It's very frightening and very stressful for us. We depend on the subsidies that the ACA provides in order to afford quality health insurance. From what I have read about the new bill in the past few days, I understand that the rates will increase tremendously for older citizens, subsidies will be reduced, coverage will be less comprehensive, and deductibles will be higher. So all of this points to just having to pay more and more for coverage that does less and less for us. We already have a 2-year payment plan at the hospital to pay off the deductibles and co-pays from my husband's fairly routine hernia operation, because even with the current situation, the deductibles are way too high and the co-pays. In the past, we've had health insurance through our employers. We're both professionals. Sam was a mechanical engineer, and I've taught high school in Freiburg. But for the past 9 years, I've been working in a different way as a teacher. I've been working as an adjunct teaching online. And so I work as an adjunct at several universities, none of which is a full-time job, although altogether I have a full-time job, but I don't get offered health insurance through any of these schools. So we've been using the ACA. Luckily, we have the ACA to provide that insurance for us. Before the ACA, we had high deductible catastrophic insurance, and which was very frightening. I was always anxious about getting sick. We own our own home. We wondered what would happen if we had a life-threatening illness. Would we lose our home? Would we lose all our savings? Once we were able to get the quality insurance through the ACA, we felt like we mattered again. When you don't have access to quality health insurance and health care, you really feel betrayed by your country, like you are worthless. And I feel that I've helped countless high school students. I teach students all over the country online how to learn mathematics, and I make a decent living, I pay my taxes, and I feel like I've served the people of this state and of the country by doing that. We're not the only ones. There are more than 20 million others in this country just like us, working and not able to afford health care. But I hope you understand that we're real people and we're not numbers. I know that you care deeply about this issue, and I understand there's a lot of pressure on you in the Senate. Your name is always mentioned in the healthcare articles, claiming that you could be one of the moderates who could vote against this bill. Let me say that I have appreciated your moderation in the past, and that is why I have voted for you, even though I am a lifelong Democrat, and I've never voted for another Republican except for Olympia Snow. So I have voted for you, and from my perspective, you have a mandate from both sides of the aisle in this state, most of whom appreciate your moderate views. Therefore, I hope you will vote with your constituents in mind when the time comes, by trying to avoid the pressure that's put on you in the Senate. We know that it must be very difficult, but we depend on you to do the right thing for all of us in Maine and throughout the country. Thank you for allowing me to share my story. I have a few questions.
Excuse me,
Yeah.
you have about 5 minutes left until the next meeting, and I
Okay.
know that there are others who'd like to speak,
Okay.
and the senator clearly wants some time to respond, so I share that with.
Okay.
Are they written?
Yes.
Do you want to just
like
hand them
yeah,
to
here's
me,
the-
and that way I can,
Yeah, I'll give you this copy. Yeah, it's just a,
That's a good idea.
and that way I could see them as you're
yeah.
moving on. Thank you.
Thank you.
Thanks. Thank you.
Hi, Senator Collins, thank you so much for meeting with us. I'll try to be quick since we only have a few minutes left, and I can follow up on Tracy and Karen and say, Karen, I really feel that she's already spoken for me in great part. So I'd like to just share a personal story. I'm self-employed. Again, my name is Laura. I live in Rockport, Maine. I'm self-employed and I'm a single mom. So I raised my daughter financially myself. She's a freshman in college now. For many years, we had no health insurance, and I feel almost embarrassed to say that, but as a self-employed person, it's very, very, very expensive. So for many years, I just didn't have it. In 2006, one of my brothers at age 38 died of a very rare type of cancer. He had no health insurance. He was working 35 hours a week for a state university, not here in Maine, and they didn't have health insurance for him. He was diagnosed through the emergency room. He received probably what would be considered quite substandard care, and he died 6 months later at age 38. 3 years later, my sister was diagnosed with a very similar cancer. She had health care insurance through her husband, who works for the federal government, for the FDA. She had excellent health care insurance, and she lived for 4 years. I remember being with my brother when he was dying, and one of the things he said was, if I could only have a few more years. If I could only have a few more years. And I've often thought that if the ACA had been available to him, he might have had a few more years. When the ACA was passed, I enrolled through the marketplace for the first time, and I'm embarrassed to say it because I have a daughter that I feel responsible for, but for the first time in about 9 years, I was able to afford health insurance through the marketplace. Right now, my health insurance premium through Maine Community Health Options would be, because it says it on the bill every month, it would be about $760 a month, because I'm 56 years old. I'm one of those older Mainers. But I don't pay that because I have subsidies. I'm self-employed, so I never know until I do my taxes exactly what my monthly insurance was, if you understand what I'm saying. It's retroactive. So in the taxes that I just filed April 15th, my monthly insurance came to be about $369 or something a month. So as you can see, it's an incredible savings for me. I've read the same things others have read about how much older Mainers like me will suffer from these bills that the House and now the Senate are trying to pass. I have to say, I don't know what I would do if my insurance went up the way that they're saying it would be, and I do have a pre-existing condition, asthma, and I don't know how that would affect things. I don't know, nobody knows. It's all been quiet, it's all been silent in another room. Nobody's been told what the bill really is, so I can't evaluate what the impact would be personally for me, but I'm very, very concerned that as of January 1st, I will not have health insurance again. And I try to stay healthy as well, but in the case of my sister and my brother, they both tried to stay healthy, and it's not something that anybody, it's not in your control. You can't control things like that. So my concern is simply that I be able on January 1st to enroll again in something that I can afford the way that I can afford it now. So again, I'm so very grateful to you for hearing me. Thank you.
Thank you. Yeah. Thanks for sharing your stories.
Okay, I'm Catherine Lipp, and Penelope really spoke much more eloquently than I would have to, I think, almost all of the points that I would make. I am almost 69, my husband is 79, so we're already on Medicare with a companion plan through my former employer, which goes up every year and is just about rising to cost us out of being able to have that plan. So we're some of the lucky people that we have that, and I know that. But I personally, and I know my husband said the same thing, I personally believe that it is a human right for everyone in this country to have health care that they can afford. In this country especially, nobody from prenatal care to ailing and failing seniors should have to do without health care. I just can't believe that that is okay. It's morally and ethically wrong, as Penelope said.
Well, the profit motive that they've added over time, and it started back in the 70s. Because I worked when insurance companies were nonprofit, hospitals were nonprofit.
Like Blue Cross Blue Shield used to.
It was all, yeah, exactly.
I know the Affordable Care Act isn't perfect, but it was a step in the right direction, and expanding Medicaid was a significant part of that. And I know you have been working on things, and I don't even have a question so much as a comment, and that is that I hope that rather than caving into some sort of partisan pressure, that you will take up the banner and march us toward something that is affordable for everyone.
Mm-hmm. Well, I'm just glad to have had the opportunity to bring these people to tell their story, and I just wanted to thank Patty for meeting with me and people that come every Tuesday. It's really, she's a great asset to you, and I feel like we've established an excellent rapport. And I think that this sort of dialogue between political opponents, to use a better, for just a word to use, that we need to be meeting in the middle. We need to be discussing things as adults, and we need to have transparency. We need to have a dialogue. There were 100 hearings during the ACA process. I would ask that you vote no in principle on the bill, only because we haven't had a chance to weigh in. There is no reason that the Senate Majority Leader should be bringing this bill before the Senate before recess. Let him go home and everyone else go home and take the heat before they vote on this bill.
Listen to people like
Listen to it.
Right.
And I urge you. You clearly have a lot of the people hear you. They see the clout that you have. You've been in the Senate for 20 years. Now's the time to use that power. You've got some allies.
Yes. Well, it's not as if, with all due respect, it's not as if I have been reluctant to oppose my party or have not demonstrated time and again my independence.
Absolutely.
So I just wanted to make that very clear, because I think that's a little unfair.
No,
the
what
implication that I'm going to quote Kay.
I'm sorry, that I didn't mean it quite that way. I'm not always as eloquent as I'd like to. Sorry.
I just urge you, Senator, to bring some more people in with you and use that power.
Could I tell you a little bit about that effort? And also, I first want to thank you all for driving long distances to be here today. I've been meeting nonstop with groups, including Resist and Lewiston, AARP, here earlier today, and many other people individually in groups, etc., which I think is a far more productive way, because everybody gets a chance to speak. Let me talk about both process and the bill and my efforts, if I could, and I'll try to cover all of the points that you've made. First of all, I completely agree with you that the process was a very poor one. I believe that the best legislation comes from public hearings where you bring in everybody who's affected. You bring in experts, and I don't think the way this bill was drafted was appropriate or good in any way. You're right that the ACA started out with lots of hearings and a markup, but in the end, as you may recall, the final part of it was written behind closed doors in Harry Reid's office. And so I don't think that's good when either party does that. There was one hearing before the Health Committee looking at the individual markets, and it had bipartisan witnesses, and I found it really helpful. And I believe there should have been hearings on more oversight kind of hearings, because as one of you remarked, the ACA's Catherine said, the ACA is not perfect, but it has resulted in millions of Americans getting access to insurance for the first time in many years, as Laura so eloquently described in her situation. And but it's also had flaws, and we've seen that in the teetering of the individual markets, so that in some parts of the country, even though you qualify for the subsidy, there's nobody to sell you the insurance. So we need to stabilize the insurance markets and make sure that people have choices and have options. I was so interested in what Penelope said about the cost of healthcare, because I think that has not received nearly enough attention in this debate. And I've been working this past year on the cost of prescription drugs, and I did a report, which if any of you are interested, I'd be glad to send to you. As the chairman of the aging committee, we looked at these companies who buy drugs where the patent has expired on it, and there's no generic equivalent. And in one case, the company overnight, literally overnight, raised the cost of the drug by 5,000%. And this is a company that had nothing to do with the research and development costs of this drug. It was pure greed, and it wasn't moral. And I was very, very concerned about that. And we investigated 4 companies that did this. We put out a comprehensive report, had public hearings, heard from experts, heard from providers, heard from patients, and heard from company executives. And this is just unacceptable. So 2 of the amendments that I've drafted, which are, I hope, going to be bipartisan amendments because they reflect bills that I've introduced, to this bill have to do with the cost of prescription drugs and making for a more competitive market. Just one more thing on this issue and then I'll switch. I know there are others waiting to talk to me. One technique that some of these companies do is they put the drug in what's called a REMS system or a specialty pharmacy, so that the potential competitor cannot buy enough of the drug to do the bioequivalency studies that are required by FDA. And I've talked to the new FDA commissioner about this, and he tried to call me yesterday, and I've got to call him back to tell me the steps he's going to take. But I want to change the law on that also, so that they can't do that. So I think the cost of healthcare is an issue that has not received enough attention, and I think healthcare cost pricing needs to be more transparent also. So I was so glad, Penelope, that you brought up.
I'm a gray hair. Most people don't have no, I'm serious. Most people don't remember the nonprofit times.
Right.
Well, it used to be that hospitals were always nonprofit,
And Blue Cross
Blue Shield, and in some places Blue Cross Blue Shield is still, but where in other cases it's not. In Maine, it's Anthem is for
I'm so
profit.
grateful you heard
So,
that. Thank you.
So I appreciate that you brought that up. Here's what I'm part of a number of working groups, and one is headed by Rob Portman of Ohio, whose state did expand Medicaid. And there are 8 Republican senators in this group because we're all upset about the Medicaid cuts. And we're trying to work out alternatives to it. I am the only one who is in it who represents a state that did not expand Medicaid. All the others are from Medicaid expansion states and are really concerned about what's going to happen. And I'm concerned too. I'm also concerned about those who, because of Medicaid, are able to get treatment for opioid or heroin addiction, which is such an epidemic in our state, such that 8% of all births last year were to addicted mothers. I mean, that troubles me terribly. So, and we know that 43% of the births in our state are to mothers receiving Medicaid. So I think we have to be extremely cognizant of the role that Medicaid plays in our state for people, for the disabled, for elderly, for children. Though the Senate bill does carve out children with complex medical conditions, just so you know. But still, we have the disabled, the elderly, children. There are a
No
lot.
child should be left behind.
There,
Sorry,
but I just wanted to clarify that and view some of the comments that Dr. Tracy, as I will call her, made. So so we're working on that in that group. I also one evening put together a bipartisan group. This was the first bipartisan meeting that I am aware of on health care. But I will tell you, and I know many of you are not going to want to hear this, but the Democrats who came, as well as the Democrats who told me they wanted to come but had a conflict for that evening, told me they were prohibited by the Democratic leader from negotiating until the Republican bill fails and we move away from the concept of repeal and replace. And that's very disappointing to me, because I think this issue should not be a partisan issue. I think it's too important, and a lot of you have talked about my obligation, which I totally agree with, to represent the people of Maine. And my record shows that I've done that time and time again. And for 4 years in a row, I've been ranked the most bipartisan member of the United States Senate by Georgetown University and by the Lugar Center. And I'm always #1 by a lot, frankly. And it's because I do work across the aisle all the time, and that's how you get good legislation, and that's what we should be doing here. So I agree this was an inappropriate process, and I don't like it at all. So where do we go from here? On Monday, the Congressional Budget Office is supposed to put out its analysis. That's a critical report. It was the CBO that said that the House bill would result in 23 million Americans losing coverage over the next decade, that it would have $834 billion in Medicaid cuts, and that it would result in premiums going sky high for those between age 50 and 64. And so that analysis is really important. That the House voted before that analysis came out is stunning to me.
Amen.
It really is. And I have told,
Thank you.
and I will look right straight into your camera here, I have told our leadership that I will not vote to proceed to this bill even until we have a CBO analysis. So I'm not going to do what the House did, which was to vote on it before the facts were in, the analysis. CBO, as that study shows, is nonpartisan. And I respect them. Doesn't mean they're always right, but they were right on and wrong on some parts of the Affordable Care Act, for example. But I want that analysis. In addition, I have 3 of my staffers working full-time on nothing but healthcare right now. And I've got the text with me, which I am personally reading, and using my background in state government, where for 5 years I oversaw the Bureau of Insurance. Granted, it was a long time ago, but those concepts still apply. I've been asking really hard questions at the briefing yesterday, for example. I asked what's going to happen to the prohibition on lifetime and annual caps, which really matters to me because that prevents medical bankruptcy in many, many cases. I mean, those are critical consumer reforms. And as I'm reading the bill, I'm not so sure that that protection is still going to be in there if a state gets a waiver and no longer covers mental health services or substance abuse services, or they still cover it, but they don't have, there can be a cap put on it. So that's a really important issue to me. So the number I want to know are how many people are going to lose insurance? Is that just because we did away with the individual mandate, or is it because of the ending of the expansion, or what are the causes, or is it because costs have gone sky high? CBO will give me some answers in that area. I want to know what the impact is on that very vulnerable population that we talked about between 50 and 64. I'm from northern Maine. We did the analysis. It was an 800% increase for someone who's age 64 and making $26,400. I mean, that's no insurance at all. And even with the subsidy, that's no insurance. The out-of-pocket costs are still too high. And the Medicaid, as I said, which is so important. In the Senate bill, there's a very troubling provision that does not kick in until 2025, a point that you made about when the impact is felt, but it so lowers the inflation rate that it's, on that part, worse than the House bill, because it lowers the inflation rate below what the House would. And that means that billions of dollars are going to be shifted to states, to uncompensated care by hospitals and other healthcare providers, which in the end, those of us who have employer-based insurance, lucky enough to have that, end up paying because that cost gets passed on, or the rural hospital who's doing uncompensated care goes out of business. And
excuse me, we
okay.
really do need to
And we've seen 2 nursing homes, one in Jackman and one in Calais, go under. So our healthcare system is already under a lot of stress. And one of you had Planned Parenthood mentioned on.
In writing.
You had it in writing.
I didn't want to take up more time.
But also Karen had it as well. Karen, right? You have it on your list of questions. I've already talked to Lisa Murkowski of Alaska, who's my ally on this issue, and we are going to offer an amendment to strike the provision eliminating the or restoring the funding for Planned Parenthood, which would be eliminated under this bill. I have to tell you, it makes no sense at all to single out one provider and say you can't participate in the Medicaid program. And also,
Thank you.
The best way to lower the rate of abortions in this country is to expand access to family planning. Absolutely. And so that is, I talked to Lisa at 8 o'clock this morning about our amendment, so we will be filing that to strike that provision. I don't know whether we have the votes or not, but we will certainly try to strike that.
Right.
And since 2 of you had that on your list but didn't get to say it verbally, I thought I would say it just so you know. So those are the issues that I'm looking at. Right now, I am deeply concerned about the bill and about what the impact would be on some of our most vulnerable citizens. I want more information to get the full picture, and in that regard, I want to thank each of you for coming in and sharing your personal stories with me. It's always very helpful to hear what the impact has been on your lives. So I'm really getting the hook here. But thank you.
Thank you.
Thank you. So grateful. Thank you so much. I appreciate it.
And that was our meeting with Senator Collins.